Okay, good afternoon, good morning, or good evening, wherever you are. So welcome to the Indonesia Project Global Web Seminar. This is the second webinar in our series covering the COVID-19 pandemic. It is made possible by the support from the Australian National University and the Australian Department of Foreign Affairs and Trade. I'm Arianto Patunru from the Indonesia Project, and together with Nurkumala Mulyani and Bhaskara Adiwena, we invite 4 speakers today. Last week, we talked about policy responses to the COVID-19 outbreak in Indonesia. Today, we will see what responses there are in Australia, the Philippines, and the United States of America. We then again reflect back to Indonesia. And here's is our lineup today. Dr. Erick Hansnata is Senior Economist at KPMG Australia in Melbourne. Mr. Ari Perdana is an economist at the Asian Development Bank in Manila. Dr. Puspa Amri is an Assistant Professor of Economics at Sonoma State University in California. And Dr. Haryo Aswicahyono is Senior Economist at the Center for Strategic and International Studies in Jakarta. Please hold your questions, if any, and we will have the time for Q&A after all the presentations. So for the first presentation, I would like to invite Dr. Hansnata. He's the Senior Economist at KPMG, and please, Eric, you can start sharing your presentation, and the floor is yours.
Okay, thank you. I'll share first my presentation here. Yeah. Okay. First of all, thanks for the NU Indonesia Project for this opportunity. I think that this is good events to share our view right now with the challenging times right now. Without further ado, I think that it's quite straightforward what's the current condition here in Australia in response to the COVID-19. And let's see the current situation. This is as per yesterday, so end of March. What happens right now is we've been conducting more than 200,000 tests. So that's nearly 1% of the total population. I do believe this is just behind South Korea in terms of the number of tests. As you know that the WHO recommendation, we need to conduct more tests if we want to know or deal with the pandemic here. Then in terms of the confirmed case of COVID-19, I don't know the latest figure, but this is from yesterday. We have right now about 4,000 confirmed cases and 18 fatalities. We cannot underestimate here, because here behind the rationale, I think that the economists not only estimating the total of economic loss, but also in terms of the health economics, because once we have fatalities, that's also a loss of what we call the burden of disease, the years of life loss. Then what about the health system? Our capacity right now, we have 6,000 hospital beds, around 6,000. That's in public hospital, above 2,000 of intensive care unit beds. Yesterday, I heard that from the Chief Medical Officer here, Professor Brendan Murphy, the private hospital will include to contribute within the health system, so you can double those numbers. What about the healthcare workforce? Nearly 50,000 doctors. Then we have more than 150,000 nurses. it will be more than that number because the data is coming from HW 2018. For the public health orders now, social distancing events, we do believe now we have a bit more strict. So maximum people, for people, so only 2 for indoor and outdoor gatherings. And I think that many people now working from home. If you're not working for the essential services, or you cannot work remotely, you can still go to work. But I think that it's very quiet. Yesterday I went to the office. Melbourne is like a ghost town. We still can see trams and trains, but literally there's no people there. So I think that the compliance from the people for this restriction is quite well at the moment. In terms of the policy response, a bit prefer to like showing you in the last 3 weeks how the government dealing with this pandemic. So let's put that into the 3 weeks time frame. Then how that, when the confirmed case increasing, then how the governments, especially from the Prime Minister, respond to the increasing of confirmed cases of COVID-19. So let's start from the 2nd week of March. So we have this number. Let's say this is the first phase, as that the title there. When the confirmed case still less than 1,000 cases. Then when they exceed the number above 100, then we have this Prime Minister with the Health Minister Greg Hunt came with the first stimulus package. Many people at that time thinking this is very small, 18 billion, even though that's a good initial response from the government of the COVID-19. Most of that stimulus goes to the what we call the welfare recipient. Here in Australia, we have a welfare system based on your income. If you're eligible, you will receive various payments for yourself, of individuals or household. The first stimulus package at that time mostly goes to the what we call coronavirus supplements. It's 550 per fortnight. But still, many people still think this is very small, considering that the UK, for example, already start to put above 300 billion pounds to dealing with the pandemic. So still, this is the uncertain condition at that time. And 2 days after that, here in Australia, we have the Formula One Grand Prix, and already like thousands of people gatherings in Melbourne. Suddenly, 24 hours the day before the peak race, the state government say that whether you want to go without the spectators or cancel the event. So I think that because of this public health, then the event is canceled at that time. So again, that's the whole thing that it's the events above 500 now need to be canceled. That's create more uncertainty, especially we have so many events here in Australia. Then I appreciate that how the governments do the effective communication to the public. So at that time, we only see the Prime Minister together with either the Treasury, the Treasurer, Health Minister, or the Chief Medical Officer, Brendan Murphy. And the information is only coming from them. This is quite effective to inform the public. And by Saturday, the Chief Medical Officer that we need to prepare for the worst. We need more. We need to be ready with our capacity, with the beds, with the hospital, including the ventilators at that time. And again, also the Prime Minister on Monday, almost 1 week after the first stimulus package, you can see with the 2 big screen explaining how to flatten the curve. So same like everyone's in social media, even the Prime Minister explained you how to flattening the curve. So quite effective communication within the first week. And you can see in the bottom there, the parliament's quite empty. It's already being spread. We have the confirmed case close to 500 the second week. And there's an idea that, well, we need more. This will be get to be nasty. We need more economic stimulus. People will lose their job, business will close, and we need support for those, including how we're dealing in the short term. So second week, we have also a signal from the Reserve Bank, Dr. Philip Lowe, to cut the interest rates with another extra monetary policy. So you can expect combine of economic and monetary policy. Then well, at the end of that 2 weeks, now we have close to 100 billion. That 18 billion from the governments, 90 billion is coming from the central bank, provide with access to credit with funds. So that's still like first 2 weeks in March, when the confirmed case less than 1,000. But when we have more tests, we also will find more cases. And this is not a good times. I mean, this is very serious. As I said, that this is between life and death. Many people will be at risk. Then on Sunday, 22nd of March, again with the treasurer, it came the second stimulus package, as much of close to 190 billion, because we can at that time we're able to see many like coffee shop, small businesses have closed their doors. Many people like lost their job. So we need more bigger economic stimulus. Came with that around 50 billion. So on top of the first and that the first stimulus, and that money goes again to cover people who lose their job, to support business, to support household, and most importantly, also to invest in the public health system, in the health system, because we provide money not just to short term, but also when people lose their job, there will be like a financial distress when people then dealing with the mental health, could be domestic violence, and also the workers in the aged care facility. You can see then by, let's say, Wednesday, 25th of March, this is really a staggering view that people lining up to Centrelink. So by system, you can like update your condition online to the Centrelink. But well, if you have like 200,000 in one day people to connect to update the condition, then excuse here and there, then suddenly people just went straight to the Centrelink, and quite a it's a few people lining up to the Centrelink, and people also starting to stockpiling for essential supplies. More public health orders in place, although it's not easy to control the people. One of the chief medical state here in Victoria slams the behavior that people still go to the beach, go to the public area for picnic, even though it's public health orders there. So it's not easy to dealing. Same I think that to other countries. It's quite it's not easy when dealing push people to comply to the social distancing. Then if you put in numbers, we expect that in short term, Australia will have close to 13% of unemployment from could be around 4.9 or 5% at the moment. So we'll expect about jump 1 to 2 million sudden unemployment and 6 million workers without a job. So it's a very significant impact. The third and the last, I think that not yesterday, so now it's here, on Sunday, another third package of stimulus of 130 billion. This is to cover people who suddenly lost their job because business cannot pay the wages. So the 130 billion of the third stimulus package, that's to cover a wage from the workers. It's so if you suddenly lost your job because your employer cannot pay your wages, the government will cover that to I think 1,500 per fortnight. So it's there right now, and I think that in the last 3 weeks we consider the government have been taking quite a decisive policy response for COVID-19. There's no perfect in this uncertain time, but at least in short term, we very welcome this policy response. And to summarize of policy response here in Australia, I said that everything must be in place. There's no secret weapon. As you said, nothing under the sleeve. We need to utilize all resources we have from the government, Treasury, Department of Health, Reserve Bank. So now people have the supplements payment every fortnight if you lost your job. Businesses, they have the support for tax-free cash flow, instant asset write-off, making the business, public health. You have this support for telehealth, so you don't need to go to the clinic. You can just contact your GP to have a consultation with them. And also some of the money from to the aged care and support mental health and just for the potential financial distress. I think that's all. That's 320 billion. Quite striking. It's equal like 16.4 of GDP, of Australian GDP, or around 2/3 from Australian budget. What happens with the social distancing? I think that this is the current key reference of compliance with the social distancing. This is coming from the University of Sydney, but I think that they quite well in explaining between 70% of compliance and 80% of compliance. So if only 7 out of 10 Australian do the social distancing, stay at home, and schools still open, you can see that it's still increasing the incidence of COVID-19. But if we can improve that, just 1, let's say 8, even schools still open, that will change the trajectory for 13 weeks, start to declining the incidence. More compliance will have a more reduction to the incident. I think this is even, it's not peer review publication, but quite well in explaining how the social distancing works in the community. What about the models? What about the overall impacts to the economy? To be honest, so many models now around there. I think that's many economists applying many methods to estimate what happens to the GDP. My institution as well already conduct one of those, but only for the first stimulus. We're still doing for the third stimulus that happened. But the thing is, when the government involved and put a lot of resource to dealing with the pandemic, I think that we can reduce the impact of the GDP. This is one of the sample, which is quite an optimist one, because there's like a rebound in the 2021. Some of the pessimistic economists think that it could take almost 4 years to back to the normal state in Australia here after this pandemic. But I need to highlight, if we want to put in models, need to forget that we need to adjust that the workers, because right now we have suddenly unemployment, business off, and when it rebounds, we need this. It takes time to adjust again between this condition, and the productivity losses, the thinning again with the global economy. The beginning, we know that the supply shock from the China, but that's become the demand shock for the whole around the world. And we will face with the new norms of the affected industry, especially those related directly to the COVID-19, from the tourism, hospitality, example hospitality. Most of the restaurants closed right now, so retail as well. So I think that we need to put into the equation how we're dealing with these new norms affected industry. So I think that we still face uncertainty right now. Even the government response is quite well dealing with this pandemic. But how that impacts to the GDP, I think that that's still a story we need to deal and to estimate in the near or long future. I think that's from me here in Australia, and welcome for question or any feedback from here. Thank you.
Thank you. Thank you, Eric. From Australia, we move to the Philippines. So let me invite Ari Perdana. Ape, can you share your presentation now?
Yes, thank you very much. Salamat po, magandang umaga. I'm trying to share my slides now. Hold on a second. And so first of all, let me start with wishing everyone all the best under this unfortunate situation. Hopefully that we can go through the situation sooner or later. So let me take you now to the Philippines to discuss the experience under the enhanced community quarantine, which has been 2.5 weeks now. I have written a more detailed discussion in CSIS commentaries number 14 under this link. Please welcome, you're welcome to see the detailed discussion. So the Philippines experience with enhanced community quarantine. It's basically a soft lockdown. Soft meaning that the mobility within communities is still allowed, although the mobility within places or within community is severely restricted. And it's not yet a nationwide measure. It only covers Luzon. Luzon is one of the 3 main island regions in the Philippines. It consists of the main island Luzon, but also some smaller islands nearby. However, Luzon population is more than half of the country's population. And within Luzon, there is Metro Manila, which hosts 12% of the whole population. Luzon and obviously Metro Manila is a center of economic activities, contributing to more than 70% of the nation's GDP. I must say it's too early to say whether the measure is effective, but it may have prevented the surge of cases outside Luzon. So far, only less than 10% cases confirmed outside Luzon, although there is still a big backlog of cases yet to be confirmed, because only 6 testing centers are across the country. 3 of them are in Luzon, 3 others are outside Luzon. The first 2.5 weeks has passed without major issues, no reports of social unrest or increased criminal activities. So, like Eric, I would like to share the timeline of COVID-19 in the Philippines. As of last night, we have passed the 2,000 cases milestone. Just last weekend, we just reached the 1,000 milestone. So over the last 4 days, the case has been doubled. 88 fatality has been recorded so far. So it brings the total fatality rate of 4.2%. Last week is about 5%, so fatality rate is going down. Almost 4,000 tests has been conducted, 3 every 100,000 population. That brings the Philippines, like Indonesia, at the bottom rung of the global distribution. More than 6,000 patients are under monitoring. Almost 1,000 are under investigation. Of the positive cases recorded so far, 63% cases are male, 62% cases are population above 50 years old. More than half cases are in Metro Manila and nearby regions. So the epicenter is still in Metro Manila and nearby cities. As of last night, 49 patients have been declared recovered. The Philippines recorded the first positive case in January 30, a Chinese national traveling to the Philippines. This patient number 2 was declared a couple of days later, happened to be the husband of patient 1. He was also recorded at the first fatality rate outside, first fatality case outside China. So throughout February, the government imposed several travel restrictions, partial restrictions from China, Hong Kong, Taiwan, South Korea, although later Taiwan was lifted from the restriction. 1 month passed without additional cases or additional fatality, but in March, things start to get worse. Early March, we discovered the first local infection in the Philippines. Patient number 6 was a Filipino male without history of international travel. Then in March 8, the government declared public health emergency status that gave the government power to tap in additional resources to combat the pandemic. Well, it was not yet declared pandemic at the time, but it was still epidemic, if I'm not mistaken. On March 12, President Duterte declared that Metro Manila will be put under community quarantine, which will be effective 3 days later, March 15. So under the measure, all traffic, air, land, and sea traffic to and from Metro Manila will be suspended. Although later the government revised that logistics to and from Metro Manila will still be allowed. Some barangays, so barangays is equivalent to villages, desa or kelurahan in Indonesia. Barangays with 2 or more cases will be put under strict quarantine. And if there are 2 or more barangays within a city, it will be the whole city will be declared under strict quarantine. Again, just to put a background, Metro Manila, also called National Capital Region, is a region consists of 16 independent cities. Each city have different mayors, different elected mayors. So imagine that you have a size of Jakarta, but you have 16 different mayors independent to each other. On March 16, the government imposed a stricter and wider measure. So the whole Luzon area is put under what they call as enhanced community quarantine. So under this enhanced community quarantine, businesses are advised to impose strict work from home, or if they still need to operate, they have to maintain skeletal workforce only, meaning only essential personnel are allowed to go to work, like security or IT people. Some sectors are exempted, like utilities, business process outsourcing, call centers, one of the biggest employment creation in the Philippines. All public transport are suspended. So under the first measure, public transport are still allowed to operate, but this time all public transport are suspended. International or foreigners or international citizens have 72-hour window to go for international flight, although later it was revoked by the government. Although now practically almost no international flights are operating from Naya. The measure was followed up by barangays issuing their own local ordinances. So in the Philippines, barangays, local governments can issue their own local ordinances, meaning they can allocate resources to impose or enforce social distancing or even strict home quarantine. They can deploy their own barangay officials to support this government, the central government measures. At the same day, the government also declared the state of calamity, giving the government powers to prevent hoarding of basic necessities or price speculations, especially for medical kits and equipments. On March 21st, it was reported that 100,000 test kits donated by China arrived, followed by another 25,000 from South Korea, and donation from private individuals like Jack Ma. So with this additional test kit, we would expect that the number of cases will still continue to grow. Although again, there will be a backlog of tests to be confirmed because, as I mentioned earlier, only 6 test centers available in the countries. Last week on March 25th, the Congress gave President Duterte 30 additional executive powers under the Bayanihan Hill S1 Act. So the additional powers include to reallocate or realign budget, to speed up procurements, especially for medical kits and equipments. Executive government can also force private businesses to prioritize contracts, especially with regard to pandemic fighting. So some media frame this as government can take over private businesses, but in fact, it's more like the government can force private sector to prioritize some urgent contracts. Central government executive power is also granted power to regulate traffic, transport operations, and utility companies, water, electricity, gas. Although up to now, the government has yet to evoke this power. And also additional power to expand social protection, plus some other measures like forcing banks to freeze interest payment or giving grace periods. And then just yesterday, 2 days ago, the government announced that they will declare 200 billion Philippine pesos, or around 3.9 billion US dollar of aid and stimulus packages. Compared to Australia and US, it is very small, but I have yet to have the details on it, but what I heard so far, it will include some expansion of cash transfers and unemployment benefit, plus some incentive to the tourism sectors. So how is life? What life looks like under the enhanced community quarantine? This is a very partial observation from what I can see under this heavy restriction. It was chaotic in the first few days. Of course, it's very predictable. So when it was still Metro Manila community quarantine, technically people were still allowed to go to work within Metro Manila, even from the nearby cities, providing they can show the proof of employment. So people lining up in the checkpoints try to enter and go to work. And before it became effective, people in Metro Manila who has houses outside try to rush get out of the city before the city is locked down. People rush to the supermarkets, try to stock their necessities, although things relatively went back to normal after 3 or 4 days. And then gradually businesses and individuals adjusted and generally comply. Supermarkets are still open. Some public markets are also still open. Restaurants, some restaurants are still open, although they only serve delivery or takeaways. And in those places, you can see they try to enforce social distancing. You will see that security personnel try to tell people to stand 3 to 6 feet apart from each other. Implementation at the local level, at the community level, varies from one place to another. Some barangays are more strict. For example, several barangays have already invoked strict home quarantine. They issue quarantine pass, allowing only one family members going outside for grocery or buying basic necessities. some barangays in the poorer regions or in the more remote areas deliver door-to-door food. The barangay officials did the grocery and they deliver door-to-door food for everybody. But in some barangays, like in my neighborhood, things are still more lenient. We are still allowed to go outside within the community, although of course mobility outside, traveling outside the community is restricted because you need to pass several checkpoints. And the positive side is law and order are still maintained, at least for the past 2.5 weeks. And what is interesting and also amazing is law and order are maintained not through heavy police or military presence. There are police or military presence in the checkpoints or in several strategic places. But basically, this has been achieved through community policing. Barangay officials are the front line of this measure. Some friends commented that maybe it was due to President Duterte effect. Well, of course, he has some notorious reputation of using forces to combat drug traffickers. But I must say that in this situation, he didn't try to project dictatorial strength or military posturing to promote law and order. Of course, okay, I'll go to the next slides first. So what lessons can we take from the Philippines experience? Lesson number one, the first case was confirmed and detected rather early in January 30. And to some extent, it may have helped creating awareness and vigilant mood in the society. So government officials or politicians could not deny or play down the situation. And the society, pretty much aware that the situation is serious. Plus, just before the first case was confirmed, there was a Taal volcano eruption. So in general, people are still under the awareness mode. So when the measure was introduced, people, it helped people to gradually adjust to the new situation. Lesson number two, central government cannot and should not do everything under this situation. It has to share the resources. It has to cooperate with local governments, community, and private sectors. Like I mentioned earlier, in the Philippines, local governments provide resources for community policing and enforcement, and in some cases, they help dropping resources, food to the door-to-door to the citizens. Logistics are still provided by the private sector. I know that in Indonesia, there is a debate that the government must provide everything, but here in the Philippines, logistics are still provided by more or less the private sector. Supermarkets are still open, meaning that the supply chain, normal supply chain are still managed to run. And at one point, the government may need to negotiate with private sector to, for example, to avoid massive unemployment, to maintain wage and employment. But I think that will be the next stage. Lesson number three, in this situation, maintaining trust between the government and the people is very important. So the people needs to see that maintaining supply, law and order is the government's best interest. And on the other hand, government needs to trust that community has the resilience to adjust with this hardship and also the ability to self-govern themselves. So as of now, again, on the positive side, we haven't heard major social unrest reported. There has been no story that people block trucks going to supermarkets, J.C. James style. There is no reports that Indian style police chasing people with rotten sticks. And there is no reports that the military or police need to escort logistics coming to supermarkets. So we don't know what happens in the next few weeks. The big question is that can the system sustain? How far the system sustain? From the public health side, there are 100,000 hospital beds all over the countries, meaning only one every 1,000 populations, very low. At most 5,200 ventilators available nationwide. Under a worst case epidemiology model scenario, we may see 75,000 positive cases in June, which will put the public health system under heavy strain. 6 private hospitals have declared they have exceeded the capacity. As of last week, 12 doctors have died, and around 700 health workers are in self-isolation. On the socioeconomic side, of course, the pressure for the poor and daily wage workers has started to kick in and will continue to kick in. In the past 3-4 years, the Philippines has enjoyed more than 6% of GDP growth, fueled by construction. Now construction activities has to abruptly stop without any clarity on when they will resume. There's some anecdotal stories of families start to request for more remittances from the family workers working abroad. It may indicate that families may already start using their savings to sustain on a day-to-day basis. Businesses are closed, or those who are still open are operating at a very low margin or even loss. And this, at one point, they will reach the limit. I'm still waiting for the details on government stimulus package. But like I mentioned earlier, it may include some cash transfers, expansion of cash transfers, and some incentive for unemployment benefit plus tourism sector. I'll stop now. Thank you very much.
Thank you, Ape. So let's fly now to US to meet Puspa Amri. Puspa, time is yours.
Okay, thank you, Ape. Thank you, Acha. Let me share my screen right now. Okay, can someone confirm me with a signal or something that you guys can see this okay in full screen? Okay, very good. Good evening, good morning, good afternoon to everyone who is watching. Thank you for joining us on this fine day. I live in Sonoma County, highlighted in the red over here. That's a population of about 500,000. We are part of the greater Bay Area County of California, and San Francisco is clearly epicenter of our Bay Area, and a total of about 8 million people live in the San Francisco Bay Area. I have been living in the US for the last 13 years, and I've lived up and down the state of California. The last I lived in Los Angeles, another big metropolitan area, and California as a whole has 40 million people. Okay, so these numbers are just to situate you before I begin the United States, a story for today. Okay, I am very glad to be joining you guys today, but I am not a public health expert, not by any stretch. I'm simply an Indonesian who's been living in the US for 13 years, and I'm sharing my global impressions of what life is like in the United States over the past 2 months. However, I am an economist. I teach macroeconomics for a living, and that profession requires me to keep up to date with current events. And an event such as this one is a typical one that I would bring into the classroom and share with my students. So that's kind of like the broad framework of where I'm coming from, and I wanted to preface my remarks with that. All right, I like to begin with statistics. Okay, it's not been a pretty month in the United States. This figure shows the evolution of positive cases in the United States since March 4th until March 29th. Okay, at March 4th, we were at about 27 positive cases and no deaths yet. I believe the first death, yes, already some death occurred at 3 deaths occurred at the end of February. The blue line here is the exponential growth in the number of positive cases in the United States, and the orange bar lines in the background here, those are their daily percentage rates. Okay, so yes, this part of the graph that I highlighted in the bottom, where it dates around March 9 till about March 16. This is when a lot of the federal government responses occurred, including the declaration of a national emergency, as well as the beginnings of the seeds of various states that were implementing stay-at-home measures. Okay, next slide, I'm going to talk about the spread of the United States COVID cases. Okay, so this map here that I grabbed from the Financial Times not only talks about, not only discusses the number of cases, but it also shows you in the shades here which states right now have a stay-at-home order or some variations of that. Okay, as you can see here, a good bit more than 50% of the United States are in some form of stay-at-home orders. In essence, that means we're not limiting, generally not limiting movement across states, but citizens are asked to stay at home unless they are implementing essential functions, grocery shopping, healthcare, take care of someone. Okay, another thing that you can read from this graph here is that the largest cases occur in 3 states, New York, New Jersey, and California. In fact, the top 10 cases in the United States occupy about 94 or 95% of the entire cases. However, a couple of new alarming cases have occurred in the state of Louisiana that I'm pointing down here, as well as Michigan, both of which have seen a spur. Okay. In terms of evolution, patient 0 arrived in Washington, the city of Seattle, from Wuhan, and King County is the area in Washington state is the area where the United States saw first death related to COVID-19. In the Sonoma County area itself, 78 cases are positive and 2 deaths. Okay, so that's the statistics. Yes, pretty grim. What I'd like to talk about now is public health as well as economic responses. Okay, these are observations again that I've been putting pieces together, having witnessed a lot of press conferences from governors of various states, as well as public health county officials, and by following not only national newspapers, but also local newspapers, Press Democrat in Sonoma County, for example. Okay. Clearly the big story, or one of the largest stories of this pandemic that scares much of us, is the economics of it. But Ben Bernanke, gentleman pictured here, who is a scholar of the Great Depression and also the person who took the United States, who was in charge of the Federal Reserve in the United States during the global financial crisis in 2008, said that improving public health is actually the first criterion for getting out of this problem. Right? This is undoubtedly going to have economic impacts, but the main difference between this episode and the episode that preceded 12 years ago in the United States is the one from 12 years ago had its origin in the financial system. It was a financial crisis of which there were a toolbox of solutions, painful, but could be deployed to tackle with it. This type of crisis can easily turn into an economic one. It's a pandemic, a public health crisis that could easily transform or metastasize into an economic crisis. But that's because the response to slow down the rate of this pandemic is actually to put a hard stop on the economy. But there's no other way. Improving the public health is actually the first criterion for getting out of this problem. Okay, from what I observe, both the federal government, the states, and the counties are adopting a multi-layer strategy. The first one is you need to test. You need to test the heck out of everyone. This is important for not only containment, but also for the purposes of contact tracing and try to isolate cases of serious COVID-19. However, clearly the United States is behind the world, behind the curve compared to other countries, and state by state variation in testing capabilities vary. It was only in March 8 that the United States Congress approved an $8 trillion package in response to coronavirus, and that contained primarily healthcare and testing. Right? Other than testing, what I've again picked up from a lot of these press conferences from the various officials is that every public official I've heard has a projection model. They have, they all say that this is fully driven by data, epidemiology modeling to be precise. And the projection models are needed particularly to get to identify what kind of health surge are we expecting? What are the hospitalization rates that are expected? And can we identify the timing of the apex? Okay, that's a very common word that's been used by Governor Cuomo of the state of New York. All right, so if we have a model, you can identify the timing of the apex, then what is absolutely crucial is that we need to slow the rate of the spread in order to not just to contain the virus itself, but more importantly, to buy time. To try to flatten the curve is only as important if it is used by the officials to actually buy time. Because let's face it, nobody is going to have enough. If this all happens in a surge, every state will be overwhelmed with a surge of patients that are related to this disease, and not enough healthcare equipment will be available to deal with this. Okay, so the flattening the curve is very important to for those two twin effects. Right. At the same time, officials have also been doing a lot of preparations. Preparations include a lot of coordination. This is where the intergovernment branch is very, very crucial. California and New York have both declared themselves as emergencies, and they've requested federal assistance. And two Navy ships have been, Navy hospitals have been parked in California, one in LA, and I believe excuse me, did I say California? I meant the other one is in New York, to try to be some sort of like a hospital relief to help with that. Okay. One of the things I've noticed in the press conferences of these officials is protectional PPE. So PPE is in shortage, and in particular, in addition to PPE, ventilators are in shortage too. It's probably not secret either. The supply is constrained, and among others, China is one of the main suppliers of PPE. But another problem is that where coordination could still help here, intergovernmental branch, is that now every state is competing to get these PPE and competing to get ventilators, which is going to push the prices of these ventilators up. Okay, so that's the broad strokes of public health responses that I've been observing. Okay, now in the remaining part of my time, I want to talk about economic responses. Okay, to talk about economic responses, I'll have to, of course, convey the gravity of the situation or the impact. I'll show you two graphs to that effect. First, since I teach money in banking, the stock market. Okay, this is the United States S&P 500 index from early February till March of last week. Okay, I think the graph kind of speaks for itself, but to highlight is that in mid-February, the United States stock market was actually on record to boost its strongest level since 2008. However, situation quickly deteriorated, but the week of the fall in the index in the week of, March 9th, so this week here that I'm highlighting, the week where COVID-19 was declared as a pandemic, as well as the declaration of the national emergency. So you saw these very steep drops over here in the stock market. That was actually a lot of action was going on there. The reason why one of the reasons why the stock market fell, as well as other kinds of markets, treasury markets, as well as emerging market assets also fell that time, because that was the week where a lot of mid-sized to large corporations in the United States were tapping their credit lines on from their banks. So in other words, they were preparing for what could possibly be lying ahead, and therefore that partly was reflected in the market here. This is also the week where a lot of Federal Reserve, the United States Central Bank, has taken a lot of action. Okay, so the second graph I want to share with you is the economic impact from the jump in the unemployment claims. All right, this number came out last week, and it was a very gut-wrenching information for anyone who's in the United States, I think, especially those who have a keen interest in observing data. Okay, so the week before March 21st was sort of the first week where these massive stay-at-home shelter-in-place orders have been put in place. Okay, in the week that ended in March 21st, 3.3 million people filed for unemployment. Okay, and the three largest states that applied for it in terms of like 100 on the scale on the right here is Pennsylvania, Ohio, and California. 3 million weekly jump in unemployment, the 3 million people applied for unemployment, that is a 1,070% jump from the week before that. Never since unemployment insurance has been recorded by statisticians have we seen a number that high. Even during two past US recessions that were severe, 2008 and 1982, the highest weekly claims were about a little less than 700,000. And although those did last a long time, as can be predicted, the sectors that were hit the worst were the services because, well, response to COVID, the antidote to COVID-19 is a hard stop in all economic activities that are discretionary in nature. And that, according to a presentation at the National Association of Business Economics, accounts for about 30% of the US economy. Data from the Bureau of Labor Statistics shows that approximately 45 million Americans work in these sectors. And many of them rent, and the median monthly rent for people who work in the sector is about $1,000. All right, so in short, no good news there on the economic impact front. What can we do? This is probably the last part of my slide that I'm going to talk about next, is the largest component of the reaction to the, the largest component of the policy response is actually fiscal policy. Okay, fiscal policy is a type of instrument that has to be approved by the legislature. So of course it usually focuses on tax as well as spending. But why fiscal policy? Okay, it's not that monetary policy is asleep. In fact, the past month has seen the Federal Reserve deploy a lot of monetary policies that were created during the 2008-2009 financial crisis to try to put a backstop, to try to keep the economy running on hibernation mode while it's at the same time it's trying to also prevent a credit crunch situation, i.e. it's trying to prevent a situation where banks and corporations run out of liquidity. But monetary policy has its limit. First of all, interest rates can't be lower more than zero. It's already at zero. But more importantly, I think the quote by Barry Eichengreen here, senior professor of economics at Berkeley, has stated that monetary policy can't reopen factories. You can't send shoppers back to the mall, and it certainly can't send travelers back onto airplanes. And this is even more is even more severe in an economy like the US, where 60 to 70% of growth is driven by consumption. Okay, so fiscal policy has got to do the heavy lifting. Okay, the key contours of the CARES Act, which passed through after like a week of deliberation among Congress, contains these items here. Mind you, not every economist agrees that this is the best way. In fact, some are saying this is not enough. A lot are saying that these are classic Keynesian aggregate demand stimulus when this is probably not the time to do it, because you can't really expect consumers to be spending at the very moment. True, but I think there's a course in between there, which is we should be concerned not necessarily with trying to use people using the stimulus to stimulate the economy in a traditional fiscal multiplier effect kind of spending creation, but they're trying to use it just to survive for the next 2-3 months amid all this certainty. Okay, so the key features are centered on providing assistance in terms of unemployment insurance and direct cash transfers. So the United States level has already a pretty regularized and structured unemployment insurance system. What this bill is adds the money on top of what the state would already be giving and extends the period for 13 more weeks. But who can get unemployment insurance is usually only people who are eligible because they have been working in the formal sector. It doesn't really count independent contractors, or self-employed people. Think of your Uber drivers or your UPS delivery people, right? These are independent contractors. So there's another category there, pandemic unemployment assistance. If you are affected in some way by this COVID-19, you become now eligible to apply to UI from your state through this pandemic employment assistance. Okay? Everybody in the U.S., as long as they don't have an income more than $100,000, will probably get about $1,200 per adult and $500 per child. And I know that the Indonesia is already discussing this in a perpu, in a regulation. Let me just share a little bit about that. In this CARES Act, the cash transfers of $1,200 per adult is going to be automatically distributed to people who are registered in the tax system. So if they file their tax returns, they're going to automatically get either a check or direct deposit by around of April 17th. Okay. However, part of this CARES Act, which by the way is about $2 trillion and equivalent to 10% of US GDP, part of that is that about 500 billion is going to actually, not in the form of direct relief, but in the form of loans. Okay, so loans fall under two categories. One is for small businesses. It's to support payroll. They're loans for now, but if the time goes by and they promise that this the loan that they receive isn't used for firing people, is used for payroll support, it will become a grant. And in addition to that, there's also a portion that goes directly to large companies. Some have been identified, singled out here as airlines. These number one and number two is probably the point of most contention in terms of the legislators on both sides of the aisle who are arguing, debating this bill. But one of the compromises is that direct loans to large companies were given. However, there was a clause, a conditionality of oversight. There should be an inspector general to monitor the activities, and there will also be some conditions applied to that. So that's in a nutshell the fiscal policy response. Will it be enough? It's hard to say. I think a fourth package is already being another package is already being discussed. That's in addition to a few other billion that was passed earlier this month to provide temporary relief for people who had to go on medical leave. Okay, so a lot of us are working from home right now. That's a privilege that only professionals can have, but many people can't, and so therefore part of the package that was released was also the fiscal package also provided some assistance for people who had to be forced to take a medical leave but cannot actually telecommute. In addition to those federal level responses, there's also state level responses. Okay, this is a spread that I took from the National Conference on State Legislators. There's clearly more than half, about 35 states have introduced COVID-19 related legislation. They of course vary in size, vary in types, but generally they cover fiscal, additional unemployment insurance. Some of them cover basically a declaration of emergency and regulations that establish the act of appropriating funds for the emergency operations that would be needed. Some also interesting ones are protection for tenants. That doesn't necessarily mean more funds, but during a 90-day period, anybody who is a landlord who has tenants, they can't evict their tenants for non-payment. Okay, an example that I have here of of the California one is the one that's related earlier to these reliefs. So you can have unemployment insurance is usually not covered for people who have to people who quit their jobs, but in this case, if people were forced to quit their job to take time off to care for a child, which because schools are closed and daycares are closed, so they have to take care of their child, that can be eligible for some wage replacement rate in the United States. Okay, one last slide, just one last slide, and I love to talk to you guys more about this in the Q&A. Is there hope? What's going on? What do we see ahead? Okay, again, these are very preliminary observations, but I'm not really an expert to talk about this. However, I want to highlight two areas that were early hit, King County, Washington, and New Rochelle in Westchester County, New York. Those were areas that had early cases of jumps in COVID-19, and they were community transmission that could be traced. Several weeks later, New Rochelle had been in a lockdown. It had been sort of limited in its movements, but now it's going to be, that lockdown measure is going to be replaced. And about King County, I kind of want to just highlight readers up here to a study based on a Washington-based epidemiology researchers who found that these social distancing measures have actually reduced, their models predicted a significant reduction in the COVID-19 transmission in that county. And we see sort of a flattening of the curve in Washington as well. Last slide I have here, the last graph about Ohio, okay? These numbers up here, the blue bars I take from cleveland.com, who process it from the Ohio Department of Health. These are the daily increases in the Ohio confirmed cases. Why did I choose Ohio? Because Ohio is really one of the first early states that took quick measures. It postponed its primary, and even when number of cases were very small already, they started to close a lot of things, including close a lot of schools, and restaurants have been closed since March 15. Not sure yet. I don't think there's enough data yet to say that this has flattened the curve somewhat, but according to Ohio Public Health, the top public health official in Ohio, that the early measures to social distance has led to about a 50 to 75% reduction in what they were at first fearing to be their apex in the healthcare. They've managed to kind of like give by the by the state more time in order to prepare for what could be coming. Okay. Yeah, I guess that's it for me. And I'm just going to stop my slide. Thank you for your time. I look forward to some questions.
Thank you, Puspa. Let me turn now to Haryo Aswicahyono from CSIS Jakarta, who's going to brief us on situations in Indonesia. Mas Haryo.
And I would like to share my screen now.
Yes, please.
Actually, my presentation is less of update because the last seminars already gave us the update of Indonesia. Maybe I will touch on the last policy, the third stimulus. But I think, no, where is all? Where is my presentation? Wait a minute.
While Mas Haryo is preparing his presentation, the other speakers, you can start reading the questions. There are some questions I see there.
You can see the presentation now?
Yes. Can you
But before I present the analytical framework, I will give you the trend. Can you see this?
It's on compliance safe life, Mas Haryo.
Oh no, it's change, how to change the, okay. I'll start with, I'm sorry, it's rather difficult to change. I cannot go back to the sorry.
Maybe I can ask Dodi. Dodi, can you maybe put Mas Haryo's slides on?
Okay.
Good, thanks.
Okay.
Which slides do you want to show first, Mas?
I think I can. Oh no, the graph on after thank you.
Okay, just go, Dodi. Can you move it? Go to the page after thank you.
Yeah.
Go that one. Yes.
Yeah. So this is the trend in Indonesia. As you can see, Indonesia is between Philippines and Malaysia. So, and the highest is the US and Spain, and the lowest is China, Korea, South Japan, and Singapore. This is the growth rate, the trend of the cases. Yeah. So Indonesia is in the middle, not very high and not very low. Next is the next graph after this. You see, even though, for example, it's surprising, maybe it's data problem. You see, Australia is much higher than Indonesia in 20%, yeah, and Philippines also higher than Indonesia. USA, of course, the highest in the world. So maybe it's because of data collection, because in Australia you have many tests. Indonesia is the lowest, but compared to Philippines, for example, not so much different. Yeah. Despite different policy. Now I will start my presentation on the analytical framework for policy for attacking COVID-19. So the first slide, the cover slide. Yeah. You see the background pictures show the challenge of Indonesia. This is in a train in Jakarta. So you see, it's difficult to implement social distancing in Indonesia. People are not very compliant, but compliance is number one variables for achieving success, as I will show you later on. Next slide. Next slide, please. Yeah. So before.
Move back one slide. Yes.
Yeah. Why you must act now? Because exponential or S-type growth, small variation in parameters and measurement error will have a huge impact. So measurement error also. So beware of the model, yeah? Because small variation in the parameters and measurement error will lead to huge impact. Yeah? So also because of the exponential natures of the spread of the virus, waiting one more day creates 40% more cases. Yeah. So maybe if the Hubei authorities had declared the lockdown on the 22 instead of 23, they might have reduced the number of cases by a staggering 20K. So time is very important factors in handling the crisis, the COVID crisis. Next.
Dodi,
Next, please.
Dodi, can you move?
Yeah. Second is you must ensure compliance. Maybe this is the second variable that is very important. So announcing something doesn't mean it will lead to compliance. Yeah? As shown by Erick, 80% social distancing compliance need 18 to 19 weeks of social distancing measures and case isolation. 90%, 13 to 14 weeks. 70% will never eradicate the virus completely. So there is a trade-off. Again, time is important. The lower the compliance, the longer the time to eradicate the virus. Yeah. So, and also under 80%, after the suppression period, there is a very high risk of the resume of epidemic. So this is a characteristic of the spread of the virus. Next, please. Can I have the next slide, please? Hello.
Dodi.
So, but without reading the paper carefully, the graph can be misleadingly interpreted and led to a fatalistic conclusion. There is no between option. You have to choose between 80% compliance or doom, right? Because you look at the red line, it's increasing, no decreasing. Since Indonesia will never achieve 80% compliance rate, social distancing policy is useless. If you only look at this graph, you see the first cover page, how social distancing situation in Indonesia. Next, please.
Yes, there is a bit of lag, Mas Haryo, so
Okay.
Dodi is on it.
Okay. You can.
Okay.
The more relevant graph in the paper for developing countries, which is very difficult to implement compliant, is the graph that compare various scenarios with no intervention scenarios. You see, before there is no intervention scenarios. There is no intervention scenarios. The graph shows that 70% social distancing still flatten the curve, but will not eradicate the virus completely. Hence, we have the risk of second round of infection. So that's the consequence. So social distancing below 80% is still flatten the curve and useful for buying time under inadequate medical treatment facilities. So that's my reading on the graph based on the paper. Next. So what is the objective now? Recession is likely and perhaps optimal according to MenQ. So it is optimal, the best that we can do under these circumstances. This is important message, for example, for Jokowi, that think that we can still stimulate the economy. Yeah. Maybe that's behind the reason behind why Jokowi always stress the economic recovery instead of saving life, for example. Also, we are not, another quotes, we are not in a recession now because the economy is struggling. We are artificially freezing parts of the economy. It's a medical intervention to slow down the virus. So that is a good thing. And economic policy, the objective of economic policy is mitigate the side effects of this treatment. So second important aspect of crisis like this, freezing the economy is not like turning off a light bulb, but more akin to turning off nuclear reactors. Yeah? So hence, this is the importance of sequencing. So the right question is not between economic and saving life, but what kind of economic policy that can save life as much as possible? What kind of economic policy that can help individual and companies get through this medical with a little suffering as possible? And the third is, of course, avoiding the long-term damage from this short-term medication. So this is the objective. Next. So I update the policy together with previous framework of analysis. So Jokowi always give conflicting messages. He said that we need tougher measures to stop flow of people into the countryside, but he refused lockdown of the country. Yeah. The first stimulus, like in US, right? Tourism and airline and housing sectors has been heavily criticized for paying too much attention to economic stimulus rather than providing social protection and saving lives. The second one is also like this, yeah, even though it's more on the maintaining the economic condition, yeah. Tax break for employees, manufacturing and importers. So, but it's still, the focus is still in the economics. The third stimulus now is more balanced between economic stimulus, saving lives, providing social protection, and also focus more on low-income groups. The target is clearer. Yeah. So we have the number of the budget deficit is 5% compared to Aussie, for example, 18%. Right? It's very small. The absolute value is 1,000 less than Australia. Australia is 20 billion, right, Eric? And Indonesia is 281 million dollars. So million, not billion. So it's in Australia is 1,000 more than Indonesia, and the percentage is much higher. So this is the update of the, and also Bank Indonesia has reduced the benchmark interest rates twice in 20 February and in the, you can see this. Okay, next. As we mentioned before, compliance is the most important factors in the success of mitigating containing and suppressing COVID-19. So I try to make a model showing explicitly what is important, what is the consequence of giving assistance, and the one variable that we want to maximize is compliance, because with compliance we can save life. So we have compliance function, saving rate divided by time of suppression, and benefit of compliance minus cost of compliance divided by price index, meaning that the upper part is micro and the denominator is macro variables. So if you have a lot of saving, you can comply easily. But when you don't have saving, you cannot comply. Yeah, it's difficult to comply. Yeah. So the benefit of compliance is, of course, low probability of infection, and also probability of infection, and also cost of, I forgot. So the cost of compliance is income foregone for staying at home. So imagine a Gojek driver. If he works at home, he lose income from driving, from working. And based on the survey by CSIS, the income of Grab driver is between 5 and 7 million rupiah. So it's a lot of income foregone for staying at home, not working. So the problem is maximize the compliance subject to budget constraint. And also in the budget, we don't see enforcement. So where's the enforcement in the budget? Since it's very important for compliance, I don't know why there is no budget for enforcement. Yeah. So I already mentioned this equation, and the model can be simplified further if we target the intervention to the poor, people with saving rate close to zero. So S and T can be removed from the equation. So it's just cost and benefits of compliance. Yeah. I remember I do a research during the crisis. There are 3 Ds there: deindustrialization, deformalization, deurbanization. So people move from city to village. So they also decide between cost and benefit staying in the city and cost and benefit pulang kampung, going home. What is the benefit of pulang kampung? Of course, many costs that you have to incur if you stay in Jakarta, like housing, yeah, we call it cost, or rumah petak, yeah, you have to pay for your staying there, staying in Jakarta. But if you go to kampung, you can stop the rent for the housing. I don't know what happened in Philippines. How can they comply if they have still to pay the rent? Also, especially for people with children, yeah, if they go home, pulang kampung, there are many social support for taking care of the children. So the challenge is not only making the people stay at home, also preventing the people to go from Jakarta to village. Yeah. Next. So I think there are 4 possible scenarios between low social assistance, high social assistance, enforcement, and low enforcement and high enforcement. So the ideal is high social assistance and high enforcement, maybe like in Australia. So, but this is very costly, right? Because you have to spend the money for social assistance and spend the money for enforcement. And also, if you have a high social assistance, meaning high demand, maybe you can have a risk of inflation problem. Aggregate demand increase, the supply side is inelastic, so possible inflation. Up to now, Indonesia inflation is under control. Yeah, and now the second possible, the worst case scenario is low social assistance and low enforcement. Yeah, hands-off approach, rely on herd immunity, possibility of looting because doesn't work. There are a lot of opportunity outside outside home, including looting. So the economic of crime, yeah? The cost of benefit is in doing crime. The third possibility is low enforcement and high social assistance. But there is a possibility of gaming the system. You get the assistance, but still go out, still not comply with the social with the social distancing obligation. Yeah, and also high enforcement and low social assistance. This is draconian scenario where government enforce but give little to the poor people. So you can imagine it will be a riot, yeah? Possibility of riot. So this is the choice of your policy. Next. So how to relax the budget constraint? Yeah. The first question related to budget constraint is where the money come from. And it has been discussed comprehensively by Pak Khatib Basri last week. Yeah, it's very little possibility to get more budget from, for example, bond or loan, foreign loan during this time of crisis. Yeah. The second problem is the trade-off. As you can see in the formula before, yeah, the cost benefit is in the nominator, price is denominator, because what's important for the people is not the nominal value of their money, but the real value of the money, real purchasing power after correcting with inflation. Yeah. So it's not the time of Keynesian, because under the inelastic supply, increased budget may induce inflation. So for example, last week, there are in our audience saying that we need to increase the budget to 10%, or like in Australia, 18%. Yeah. How it will affect inflation? That's another problem. The extension is including some other factor like information technology, yeah, or information, because information is very important in saving life. For example, the higher the testing that you perform, the higher the chance that you can get the target, yeah, the better targeting. So it better do random instead of targeting only or testing only the suspect. So we do a random testing and using statistical analysis, combining with other socioeconomic variable to get a better target for intervention. The second is technology constraint. For example, our ministers, our information minister, already employ or utilize the BTS tower and your and the handphone, the mobile phone, to monitor crowd, so you can know where the crowd is, so you can deploy the enforcement force to disperse the crowd. So that's the possible use of technology to increase compliance. Yeah. The second is technology constraint or technology factors. We know we have scarcity of ventilator. Yes. So nowadays there is using 3D printing to make ventilators. Yeah. And if you search, Google search 3D printing and ventilator or COVID-19, you can find many innovation on that. Yeah. Also retrofitting firms to change the production into the health production. So I think with this, maybe we can have a better policy, understanding what is the importance of compliance, how to achieve compliance, knowing the cost and benefit of compliance will make a better policy. I think that's all that I want to say. Thank you very much. Oh, first, this is the irony. So we fight the virus with declaration and ignoring social distancing. Thank you very much.
Thank you, Mas Haryo. I will now start collecting questions. So if you have questions, please virtually raise your hands there. I will take 3 questions. But before that, because I see some people already ask questions through Q&A feature, and thank you for speakers who already answered that live, but I will still give you a chance to pick on some of these important questions to respond, and then I will follow the order as we present it. So I will go to Erick first to respond to some of these questions, and then I will collect questions from those who raised their hands. So Erick, you go first. Can you unmute yourself first?
Okay. Is there anyone raise their hand?
No. Yeah. Did you see is there any question that goes to you for?
Yeah, I have answered.
Oh, you answer. Okay, thank you.
This question.
Okay, in that case, let me go to Ari Perdana.
Yes, similarly, there are some questions addressed to me and then I have answered them.
Okay.
I hope they're satisfactory.
Okay, so many of you already answered. So let me now go to those who raised their hands. I have Kevin, Taswin, and Puspa.
Acho, may I actually respond to a couple of the Q&A questions that I didn't get a chance to?
Okay, briefly, please.
Sure. There's a question from Netta about whether the US will experience another Great Depression eventually. That possibility is not zero, in my view. It really depends on the scenario and how long we are in this hibernation mode. But they will be through a different channel. That's why all these measures ahead of time will hopefully prevent that situation. But we will surely, a mini recession, I'm almost guaranteed. Thank you. Then I'll move on as other opportunities arise to address other questions directed to me.
Okay. Well, while we go to the direct question, Mas Haryo, can you read the question and answer so you can respond afterward? So let me now ask Kevin, Taswin, and Koalisi Seni Indonesia to ask their questions. So Kevin, you go first.
I think I have the...
Hello?
Kevin? I think we're having a problem there. Mas Haryo, you want to say something?
Yeah, I would like to answer maybe 3 questions. Yeah.
Okay.
We should not worry about price increases for personal protective equipment. On the contrary, we want as many firms to have a strong incentive to supply this stuff as possible, and higher prices are exactly what is needed for this. Yes, it is under a normal situation and perfect market condition. You know, the situation is there are a lot of externalities here. Yeah, because under externalities, a lot of externalities, I mean, the externalities is infecting other people. So under externalities situation, it is perfectly good to subsidize it. That is the economic theory. If it's perfect market and it is only private good, which don't have any externalities, yes, price mechanism will work. But it's a different situation where externalities is very high. That's my answer for the first question. how do we measure compliance of social distancing policy in Indonesia? Is there any possibility of using technology for such purposes? Like I already discussed this before. Yeah, our minister already used this. Our minister also already used the Facebook also help us giving data on movement of people. Yeah, maybe we can also cooperate with Google Maps to know where the people move, because in your handphone you have timeline of your activity. It's negative. It's dangerous in the past, but it's useful now. Yeah, you can trace the movement of people. Yeah. How do we measure compliance of social distancing policy in Indonesia? Yes, oh, I already answered this. Okay, I think I answered all the question.
Thank you so much.
I like the question of prices.
Thank you, Mas Haryo. I see that actually there's an overlap between Q&A feature and raise hands feature. So we just go now to the Q&A. There is a question from Professor Halhil asking about this fiscal stimulus. Can we get a sense of how quickly it can be disbursed and how effectively it can be targeted? Let's go to Indonesia first. Do you have a sense of this, Mas Haryo?
I think it will be quick, but the problem, the problem is targeting. I think it's still problematic in Indonesia. For example, we already have database on that, yeah, and it's already updated. Mm-hmm. So I think in some people that's already in the target, already in the database, it will be much easier.
Right.
Secondly, for example, subsidy or assistance for paying electricity. This is automatically targeted, right? The electricity company knows which household has 15 watt hours power. So the lower the power, the lower the socioeconomic status. So it's already easy to target. The difficult one is the one that is not covered by PKH. I don't know in English. So the low income household that is already in the database before. So it's easy to target. But like employment or small scale industry, it's very difficult to target.
Right.
Okay.
Okay, let me now go back to raise hands feature. Kevin, are you on now?
Hello?
Yes, go ahead.
Yeah, so my question is pretty straightforward, and I think the relevant case that would best answer my question would be the lesson that we can learn from the Philippines. So, sorry, just a brief introduction. My name is Kevin. I am from ANU and a student of Master Public Policy, and I'm specializing in policy analysis. My background is on digital economy, so my question is about more about gig economy and perhaps in general those who are working on in the informal sector. So the problem with the people who are working in the gig economy as well as informal sector is that there's no social security that can help out to reach to them, unlike those who are working in the professional sectors where they can have their office, receiving benefits that can be passed on from the government to these people. For example, things like people like who are working for Gojek, people who have online shops and Tokopedia and all that. How do we best, I guess, distribute the financial benefits to them? I remember that from the last discussion with Pak Khatib Basri, one of the main idea was to continue to support with BLT or cash transfers. But the problem with the Indonesian standard of poverty is that those who can receive cash transfer will have are the ones who only, I think, spend less than $2 per day, if I'm mistaken. or less than that. But then the World Bank standard and the Indonesian standard poverty is very different, which means that although these people might not be considered as poor by the Indonesian standards, but they are on the verge of, getting back to poverty. They are very vulnerable. So in that case, how do we best address the problem, how we can sustain these people financially? Thank you.
Thank you. Excellent question, Kevin. Before Mas Haryo, can I ask Ari Perdana to reflect on this and the Philippines, and then go back to Indonesia to Mas Haryo? Okay.
Yeah, sure. Thanks, Kevin. And also this question related to Mas Budi's written question earlier. Unfortunately, Mas Budi, I don't have right on my hand about the slides on Philippines social security, social protection programs. But I agree with Kevin. The issue with informal sector, or in the Philippines, there are a lot of slum areas, quarters areas that it's part of the daily life. But in this kind of situation, I still wait to see how the government approaches that. And I forgot to mention in my presentation, yes, it's difficult to monitor, to police social distancing in those areas for sure. The Guardian put an article about the Metro Manila slum community under this COVID, and one of their comments was that well, I can avoid virus, I can recover from virus, but I don't know how to eat. That's just the reflection. But in the Philippines, there are social protection programs. The national flagship program is the Pantawid Pamilya, 4P, the conditional cash transfer, which was released at more or less the same time with Indonesia's PKH, but it has expanded, and I believe that will be the first obvious channel for the government in providing some relief or cash transfers. There was a plan to expand, to increase the amount of cash, but also to expand. And I think they have, like Indonesia, they have a good targeting database for that. And there are also the PhilHealth, which is similar to Indonesia's health insurance, social health insurance. But the difference is that they have covered more informal sectors. And I think this is also related to the Philippines having a lot of overseas or migrant workers. So there was some reach out. So the migrant workers who going abroad need to have this insurance, but also they use the opportunity to expand to the family members. So migrant workers have family members in the Philippines who work as drivers or informal sectors, jeepney drivers. They have pretty much covered, not all of them, but a big significant amount of them are covered by the PhilHealth and also the Social Security, the what do you call it, pension benefit. So I think that's the database that the government can use to expand. I also heard that they plan to provide some relief for workers affected by this COVID-19, especially in the tourism sector. I'm still waiting on how the mechanism on how to target them. There are also some local government-run social securities. Acho, if I can directly respond to Lydia's question, which I haven't.
Go ahead.
Yes, about internal migration, urban to rural or deurbanization. Because the measure was taken very abruptly, it only left a very small window for people to went out Metro Manila and Luzon. So I don't think there is a big well, there was a big exodus, but there's not a massive exodus, India-style exodus before or during the window of the community quarantine. The biggest test is next Easter break. It's a big celebration for for Filipinos. Filipinos used to come home during the break, but the transport has been practically suspended. So I don't think that there will be a measure on how people will be able to return to their hometown, but this is a test. So I don't know if the situation gets worse, maybe people will prefer to break the curfew and take the risk on going for Balikbayan.
Thank you, Ape. Go back to Mas Haryo. And I think responding to Kevin's question also address question from, it's already an addressed question by Koalisi Seni Indonesia, Mbak Reta Dunga on the gig economy. So Mas Haryo on Indonesia.
Yeah, regarding the the ojo, yeah, the Grab bike,
Yeah.
the income for them. I think first we need to weigh things between risk of infection and money, right? And so I think with the proper protocols, the Gojek driver can still work. The protocol is 3. So ensure there is no contact between the Ojo driver and the buyer, right? For this is especially for food, yeah, for GoFood, yeah, or yeah. So I think Grab Bike and GoFood already implement this. So they designate us where is the place that I should give this this food to put the food in the house. So you don't need to be in contact. That's the first protocol. Second protocol may be for the restaurant. Yeah, make the restaurant wear protective gear, wearing mask, everything should be clean, everything. So that's the second protocol. The third protocol is for the buyer, for the household. So you have to cook it well again, maybe. Yeah, if you cook the food that you buy, even from the unclean restaurant, you still can remove the virus from the food. So we reduce the risk of infection with these 3 protocols. We discussed it in the group actually, because some Titi Anas asked that.
Okay.
The second possibility is making them the deliverer for the assistance. I think that's already also considered by the third stimulus. So, you know, under this situation, distribution is very difficult, right? If you want to distribute this assistance, that you cannot do it through bank or to whatever other means, maybe you can use the driver. So the government and employ the drivers as deliverer of assistance. That's second possibility. I think that's my response to the situation for Grab Bike and GoFood. And I think also there is a special assistance for them as well.
Yeah.
In the package. I don't know whether I discussed it before. We discussed it before the announcement, but the options. But I don't know now.
Thank you, Mas Haryo. Let me invite Pak Chris Manning to give his question. Chris, are you there?
Yeah, I am. Yeah.
Silakan, Pak.
Ari gave some emphasis to the role of the barangay in Manila and in Luzon, both in implementation of programs and in the distribution of welfare of goods. There's no mention of that in the case of Indonesia. I wonder if Mas Haryo could give us some indication of what's going on there in Jakarta in particular, where of course most of the cases are. And are there any lessons from Australia and from the US in regard to local level initiatives, either in implementation or in support, social support for the poor?
Okay, Mas Haryo first, quickly, and then go back to Erick and Puspa.
It is distribution, yeah. I don't know much about this, but I heard that they will also utilize mini market for that, because there are the mini market now in Indonesia is everywhere. So unlike in the 1918, for example, distribution is difficult. Nowadays, there are millions of mini markets, and everybody is near mini markets, even in the village. So maybe government should work together with the mini market to distribute the goods.
Okay, that's good insight. Erick?
Yeah, I'd like to address 2 questions, and also for the social initiative. For the coalitions in Indonesia for the art sector, that's I think one of the first priority here for the state and also federal government is when the full impact on workers in arts. They already like put some initial support for especially for art workers, tourism workers, then in retail. So in specific for Indonesia, I think that they could also let's replicate action those who directly get impacted from this pandemic. And in terms of social distancing, why that 80% is the standard? Looks, it's the paper itself. That's basically for Australia case, but I do believe many of the advices out there that they must like as much as possible of social distancing. So I don't think that 80% is the benchmark. If we can push society people to as much as comply with the social distancing, I think that's the key action to reduce the incidence of COVID-19. For the social communities here, I think it's quite very overwhelming support. Many of the groups here in Melbourne in particular, they're offering any kind of help from foods, offering people of living within their residency. So many people now cannot cope with the rent because suddenly you're jobless, you cannot pay your rents. Many people like offering part of their place to renting. So I think that's quite. And this is the times for everyone. Any things that you could contribute, stay at home is contribution, but any things that you can offer helps community. I saw a lot of things, people like getting funds for help, equipment. I think that this is the time for everyone to contribute. Any things that you can put or support as soon as possible. So for not only for Australia, but I think it's also in Philippines, in Indonesia, also in the US.
Over to Puspa. Puspa, can you unmute yourself?
Sorry. Hi. The US is on the hook to be fiscally to be burdened by an additional $2 trillion in stimulus at this point. But the main difference that the US has over other countries in the world is it can actually have a much larger fiscal space because the United States debt issued by the US government is considered the most safest asset in the world. Plus, at the same time, it's got the most powerful central bank that can stand ready to actually purchase government bonds. So that would enable to ease the burden a little bit and keep the interest rate low. I don't see any of this possibility. I mean, for any fiscal stimulus lessons learned for Indonesia, I think the package needs to be really huge. I don't know if the idea has been discussed much, but international financial institutions should actually try to step in this case, in the way that IMF has loans for financial crisis. There probably is already discussion about this, but this pandemic specific loans, I want to kind of urge that policy. If there's already something being cooked in the books here, hink nod to the people in the room who might be responsible for this. Second part I want to respond quickly to is that something that I've observed a lot in the US communities here is that people are socially helping each other. Local stores are setting senior only hours so that senior citizens can shop in the groceries without having to compete with those who are not as agile, I suppose. And also there's been a program where communities try to identify who around them are seniors who might need some assistance in doing these tasks, as well as people coming together with ideas with trying to buy gift cards from restaurants, try to keep them alive, because restaurants are still open during this time. They're just not allowed to have people dine in. I think that's all I'm going to chime in for now. I've answered a few questions on the Q&A. Thank you.
Good, thanks. I see a question about lockdown policy, but I will defer that to next week webinar, because the topic next week, if you're still here, please attend, it's going to be restricting human movement, public health outcome, and economic consequences. That would be our the third series and next week. So let me go back to the next question. So hold on. Prapti. Prapti, or is this Ross? Ross.
Actually, it's Mr. Prapti.
Apa kabar Pak Ross?
Kabar baik.
Silakan Pak.
My good istri allowed me to borrow her computer. I just wanted to go back to the question, one of the questions that Haryo addressed, and that was about the price increases for personal protective equipment. There's a saying in policy circles, I think, we should not let the perfect be the enemy of the good. And I think Haryo's answer to that question was along those lines of looking for perfection. Okay, you can say we've got an externalities problem here, and these are not normal circumstances and whatever, but I think it's precisely because of that that we really ought to recognize this very simple reality. Firms will produce stuff if it's profitable for them to do so. And firms that are not in the business at the moment of producing surgical masks or hand sanitizer or ventilation equipment, they'll develop an interest if it becomes profitable for them. So if governments are now in the business of trying to suppress price increases for those sorts of things, then they're clearly doing exactly the wrong thing, because what we need now is a very quick supply response. Forget all about externalities and forget about paying more than it really costs. That just doesn't matter when our government in Australia is contemplating spending $240 billion or whatever the number is, paying a little bit extra for, or even a lot extra for this personal protective equipment just doesn't bother me at all. I want my face mask, I want the ventilator when I need it in hospital, and I don't give a damn what it costs.
Your response, Mas Haryo?
I think you're right. Yeah. Now we can see ourselves and everybody else as pollutant for other people. So what is the solution? I think it doesn't mean that the firm become not profitable. We can subsidize them. I mean, they are still profitable. They still get the profit, but we sell it to the people at a lower price. Maybe that's the middle ground solution.
If you want to arrange a subsidy, it's going to take time. People are dying now. We want action quickly.
Maybe, I don't know. But because if we focus on poor people, maybe. But the price of if the good is gear masks, the mask, maybe it's still affordable even though it's higher price. But I don't know other like hand sanitizers. I think there's not much problem in there, because in terms of mask and cleaning, because the best way to clean yourself is the cheapest. That's the soap, not the alcohol. So I don't think there is a problem with this. Yeah, not increase much, I think.
Okay. Sorry, Ross.
Yeah, sure.
In the interest of time, I will take one question from Q&A and one question from raise hands feature. So si Wage asked Mas Haryo again, what is your take on the institutional capacity to enforce compliance for social distancing measure, and why 80%? I think that also relates to the Australian study. Maybe Eric also can chip in on that. And then after this, Mas Haryo and Eric, I will take a last one from Taswin from the raise hand feature. So on the 80%, Mas Haryo.
I agree with the study of Australia that if you want to completely eradicate the virus so that it will not emerge again after the suppression, yes, you need 80% or more. But if you want to flatten the curve, of course it will risk next outbreak. Okay. Then you don't have to be 80%.
Maybe the question is more like, where is the 80% coming from? So Eric, can you explain that?
Yeah,
Oh,
in
I'm
terms
not the modelers, but I think, yeah.
So the University of Sydney, they're doing this in the time frame of 13 weeks, 91 days. What happens if, well, the data itself is coming from the early incidents in Wuhan. So if one person got infected and they just like life as usual, then you will like have this exponential effects and suddenly have a huge numbers of people. So that number of 80%, it is showing how the importance of people contribute. So as I said in my slide, the draconian, it's us. The social distancing is as much as we can, and we only going out to buy the essential supplies. People, the works is for the essential service, but as much as we can to implement, to push people, follow the compliance of social distancing, that will, as you see in the graph, that will reduce quickly the incident. So that's only showing the benchmark between what's the difference between 7 people comply with the social distancing and 8 people. So the model is just showing that that's actually the boundary. The best is everyone just follow as much as we can to follow the social distancing.
Good. Thanks, Eric. Last one,
Taswin.
Sorry, Haryo?
I will continue this. I think in the model, the most important variable is replication rate.
Okay.
So replication rate berbanding terbalik
inversely related.
Inversely related to the social distancing. So the higher the social distancing compliance, the lower replication rate. And because it is not linear, it is exponential. There will be more than one equilibrium. Yeah, maybe that's I think.
Okay.
Thank you.
Thank you, Mas. Taswin.
Okay. Morning, everyone. Morning, Acho, Anto.
Yeah.
Taswin Munir from Global Green Growth Institute in Indonesian Country Office in Jakarta. I think we have enough information so far from social media, mainstream media. The ones that we experience every day here, it's a dilemma between telling the truth and then trying to comfort people. So my question is, what is the balance bar between raising awareness by telling the real truth that we are still going to the peak? We're still, the numbers of cases and death toll are still rising, and we don't know when the peak is, whether it's in short term or longer than we thought. And trying to comfort people, because some people, I experience myself in the social media groups, they don't like when we try to share the news that we think might interest some of us related to COVID-19 and then what's going on out there. So what is the balance between raising awareness and try to make people ready for the worst case scenario, hopefully it will not be, and then trying to make people really live in comfort and then not putting more stress on them because the news is everywhere about this pandemic. I think that's all.
That's a good question, Taswin. Who wants to take this? Speaking of roller coaster psychology, I think it's the best example is the US. So Puspa, can you take this?
Okay. I'm a little bit having a blank in my thought right now. Maybe I can come back to this after hearing some others.
What about in the Philippines, Ari, and before Mas Haryo?
Yeah, maybe let me jump in because before Mas Haryo always provide the gong for all answers. I think I agree with Mas Taswin. This pandemic happens while we are already in the peak of social media. The last global pandemic we had, I think it's bird flu, swine flu, and SARS. I think the penetration of social media was not as heavy like this. So I think we are, entering many new fronts at the same time. But so my response is related to an earlier question I received in writing. So what's the experience of the Philippines? So in the Philippines, I think it's like Indonesia. It's a very polarized politics. People have different camps. But at the same time, I don't see that the government is trying to play down or hiding the information. I mean, people have lack of confidence in the government, but at the same time, the government didn't try to package that they can do more that they can do. The government put the public health expert and public health numbers in front. The other government branch try to play the supporting act, like the Department of Transport issuing the guidance to social distancing in the public transport, which only valid for 2 days because after that all public transport was suspended. That's just one example. And DSWD, Department of Social Welfare, came up with this is the idea of some volunteering activities. So it's not that the government try to hide information. They admit they don't admit publicly, but they don't try to hide that they are overwhelmed, and they don't try to hide that they are, reaching the capacity. So I think that's one good model that we need to follow. That the truth speaks up. Because if you are the government and you withhold the truth, and if you try to portray that you're more capable than you are in the social media era, then other channels will speak up the truth.
Thanks, Ape. Mas Haryo?
I think Indonesia is the opposite of Philippines. That's the summary. Yeah, and Indonesia, even the government itself, that's undermine the situation or underestimate the situation. Take it lightly. It's only until recently that we have juru bicara speakers. Yeah, that announce clearly and with transparency. Before, there is always denial. That's the situation in Indonesia. My second observation is the fears of virus is only in the middle class. The lower class doesn't fear at all. Seems to me. I have my driver. Yeah, they said no, it's not dangerous. This is only for the rich people, the virus, not for the lower people. We are strong, something like that. Yeah. So I think in Indonesia, the supply of awareness is low, or no, they don't care. No, they don't care. They don't afraid enough to protect himself. Especially for the poor, the trade-off is not between infecting by the virus and not infecting by the virus, but the threat is between infecting the virus and cannot provide money, food, paying electricity if they don't work. And it is more real for the poor than the abstract possibility of infection by the virus. Thank you.
Okay, thank you, Mas Haryo. Oh, Puspa, you have something to say? Go ahead.
Sorry, there was two questions in the Q&A I realized that I hadn't answered. One was, how will this impact U.S. elections? I think this may be important on a number of fronts. One is that primaries have already been extended in some states. It's a kind of like a double-edged sword, because some see it as, yes, it's necessary to at least come up with ways to not force people to go to the polls right now, but at the same time, there's fears that this could actually be leading to voter suppression. So a lot of the states have already now put in their bills a number of measures to make sure that that election is addressed. And the second part is inflation. Well, with $2 trillion of extra fiscal stimulus and the Fed buying bonds, is inflationary pressure there. There's, again, a polarized answer to this among economists, just like there's a polarized society in many of our countries today. Those who are more the supply side, classical economists, think that there will be, clearly, especially because supply side is constrained. But most Ben Bernanke said, and a few other, the general economists' tendency seems to be this will be based on the lessons from the last crisis in 2008. The inflationary pressures are low because the banks are probably going to hold a lot of the loans in the reserve. It won't go to extra spending.
Thank you, Puspa. So before we close, Eric, do you have anything to add?
I just like to highlight that one of the state government here, the premier, said like days ago, the money is not a problem at this time. So, our calculation itself to pay the current economic stimulus, it will take 2 decades to recover from this stimulus. So, look, this is once in a generation. So the debt itself will pay into generation debt. So let's just focus what we can do, and you know, this is not about trade-off, but just to focus, because people are dying. So what we can put in place, what action we can do, we need to take action right now, and not delaying with the policy response.
Okay, thank you, Eric. So I'd like to thank everyone. Thanks for attending this, and then my apologies to those who have questions but we cannot address in this limited time. So, and thank you for all the speakers, and I think we'll see you again next week. So bye now. Thanks.
Thank you, everyone.
Thank you. I still try to answer the written question as much as possible, but yeah, that's the best I can do right now.
Good. Thanks.